Nurses, doctors of Reddit, what's the rarest, least common medication you've ever had to administer and why? Respiratory therapist. I gave nebulized morphine to a sweet old lady who was dying very painfully in front of her family. There were about 12 of us in the room including me. The PA fought a pulmonary group that was covering the ICU for the weekend that ordered it and her family. 12 of us in a tiny room. I didn't think about it at the time because I was very concerned about it being out of my scope of practice, and because it was the weekend I didn't have a chain of command to really ask. But you know, nebulizing an opiate in a tiny room with a lot of people. When the PA and I came out after 4 minutes and the treatment was finished, I said I felt kind of funny and the PA laughed kind of weakly, then sat down. My pupils were pinpoint. We also used to nebulize vodka for pulmonary edema, although I've never done it so can't vouch for it. A poop fecal transplantation. At my first internship during nursing school, there was a patient with a bowel infection caused by Clostridium difficile. A few months before, he got treated with broad-spectrum antibiotics for a pneumonia, which caused the infection. They tried other treatments to cure the infection, but nothing worked. Eventually, the patient got accepted in a clinic trial for a fecal transplant. One of his kids was the poop donor. After the transplantation, the infection actually cleared up. I love when fecal transplant stories pop up. I had a doctor friend of a friend who wouldn't believe me a few years ago that fecal transplants were not only a real thing, but also a valid treatment for C. diff. I am truly going to gloat silently about this for the rest of my life. Hahaha. Methylene blue. I gave it to a girl who tried overdosing on Oragel. The active ingredient is benzocaine, which caused her to develop a methemoglobinemia. Treated with the blue drug, it truly is an artificial looking bright blue, and I gave it to her in her IV. Pharmacist here. That showed up a few times as a drug, which always made me chuckle because for so long in my head it was just something used to stain bacteria. Now I use it to stabilize technetium-99 metahexametazine. Methylene blue really has run a wide gamut as far as spheres in which it's found use. Sodium thiopental truth serum. In residency, someone had a conversion disorder in a movie theater. I know, way back when it was a normal thing to do. The entire place cleared out after the movie. His buddies are talking and realize he's not getting up. He finally tells them he is paralyzed and can't move. Medics brought him in. He's laying in the gurney in the sitting position, like he's an astronaut. I walk in the room and think to myself, why the fuck? I go ahead and take his history, go back and present him to my attending. Attending asks me what I want to do. I'm at a serious loss here. I have no freaking clue other than wait him out. Nobody's core is that strong. He says we should give him thiopental. Of course I say let's do it. We go in with Justice and a nurse. He turns the lights off. The nurse pushes the meds. My attending proceeds to walk this guy down with confidence and empathy, like he's walking him through the worst LSD trip ever. Sure enough, my attending asks him to realize that his arm is attached to his chest, which is attached to his back, which connects to his neck, which connects to his brain. He tells the guy, now is the time to move your arm. The kid moves his freaking arm. Amazing. After a bit longer, the kid is lying flat. Soon enough, he's up and moving. Craziest crap I saw that year. Emergency medicine. Still not dull 10 years later. Maggots. We had a drug addict come in who had let an infection go so long in his arm from repeated needle usage that all our attempts to clean it failed. We ended up using maggots to eat away the dead tissue, while leaving the healthy tissue intact. Dude just had an open wound full of maggots loosely covered in some gauze for like several days. The worst part is always having to collect them afterward. The medication most people are shocked by is C hydrochloride. Yep, C. It's a good vasoconstriction agent and topical anesthetic. It was many years ago and I was working with end-stage cancer patients. This one woman, who began her treatment outside of the United States, was given a mixture of C, H, alcohol, morphine, phenothiazine and some other antiemetics. It was specially made into a liquid and imported from somewhere in Europe. I remember this med so vividly because it's not every day you give someone H. I think it was called something like Brompton cocktail, and the lengths that were gone to check out and administer a dose of that stuff. We're talking who's got the nuclear codes type of system. I have to admit though, it worked like magic. Yep, Brompton cocktail. Developed in the Royal Brompton Hospital in London. It can also contain chloroform water and thorazine, and some formulations specified gin as the preferred alcohol, apparently. I gave an old man a M&M one time when he was demanding a sleeping pill. Blood pressure was too low so doctor wouldn't order a real one. Worked great. Anyone saying that this is unethical, please realize that this was done with the patient's safety in mind. In a real world hospital, safety is always the first priority. Things aren't always as clean, neat, perfect, and morally sound as they are on Grey's Anatomy. Also, I've done this maybe twice in 11 years. This isn't common practice and it has happened in very, very special circumstances when the family has been aware and encourage it. I don't just go around lying to patients and giving candy instead of medicine on a daily basis. My co-worker had to use something called Hyaluronidase recently. It's given sub when vancomycin infiltrates in a knife, meaning that it gets out of the vein and starts pooling in the local tissue. Vanco is toxic at high levels and it kills the tissue. So when this happens, you have to give multiple small doses of this drug with a tiny needle into the surrounding tissue to break down the vanco and save the tissue. Hyaluronidase is also used to dissolve bad face veneers, lip filler and stuff, if they turn out wonky, or, more serious, if they are injected into a blood vessel, which can cause necrosis. Not a doctor or nurse, rather the patient. I have a super rare liver disease called Wilson's disease. There are trace amounts of copper in everything that we consume. For most people it's bound to your urine and excreted the normal way. It was the mystery illness causing all the weird symptoms twice on the TV show House. Literally every single doctor I've come into contact with, except for my liver consultant, has remarked that they've never met a patient with Wilson's disease and that it is one of the diseases that they learn about in medical school because of the weird ways it can manifest. Not only that, but there are two different chelators, drugs that help to bind copper, which are used to treat patients with Wilson's disease. The more common of these two, penicillamine, caused me to become immunosuppressed. My immune system basically shut down and I had to go into isolation. So, not only do I have a ridiculously rare liver condition, but I also get prescribed the less common drug that is used to treat it. It's called Treantine, and I have long lost count of the amount of times I have been asked how to spell it. Some people have stars in their eyes, but you've got rings. By far not a doctor, but a relative of mine had a lot of problem with allergic reactions, especially on the skin, where weird looking welts would form. After about a year of trying out treatments, they eventually used a medication of which the basic component are ovaries of a hamster. They had to repeat giving him those syringes a few times, but then it was successfully treated. Sounds like urticaria, hives, which is an allergic type reaction. Omalizumab is a drug that can be used to treat it and is produced in bioreactors from Chinese hamster ovary tissue like a lot of other similar drugs are. It works by blocking Ig receptors, therefore reducing histamine, so is an indirect antihistamine. When I was a travel nurse, the nurse next door to me had a patient who was bitten by a rattlesnake. Was in pretty bad shape by the time they made it to the ICU because they were hiking in desert rural nowhere when it happened. The two pharmacists, which is already unusual, brought the antivenom down to the unit like they were holding the keys to the Ark of the Covenant. Seriously, they were walking slowly and one of them was holding it and the other was holding their hands underneath it. Turns out the cost was something like $40,000 a vial and the patient needed 3 total. I didn't give the medication, but it was one of the most interesting nights I've ever worked in the ICU. And that's saying something. I've gotten to give rattlesnake antivenom 3 times. Basically my former hospital would stabilize the body by giving the initial doses of antivenom in the ED, then send them to my unit. Then I would base the decision for additional doses on my assessment of any symptoms and a call to poison control and written protocol. It was interesting, scary, because after the protocol was initiated it was up to my nursing judgment whether to give more antivenom or not, which is how any protocol works, but it was just weird following one with such an uncommon expensive $3K plus med. Demerol used to be a fairly common pain med but is rarely used for that anymore. I used it once in the ED for this weird intractable tremoring that was thought to be a side effect of an experimental cancer treatment. Only used it because the oncologist asked. That was kind of interesting. Pharmacy called me and thought I had lost my mind until I explained. Also got to give Dantrolene for post-anesthesia malignant hyperthermia. It's on all the tests, but outside of maybe anesthesia you don't see it, so that was cool for me as well. I literally used this last week to treat post-anesthesia tremors. It's the only reason we stock it in our PACU. Tuberculosis to treat bladder cancer. Not in healthcare, but my grandfather has bladder cancer and one of the recent treatments was injections of TB. I have no idea why, I just know it didn't work. I worked with a guy who had this done. It was administered via the urine catheter, not IV, so apparently it causes the bladder cancer to be surrounded by fibrous scar tissue and slowly destroyed. As the TB has difficulty leaving the bladder, it just attacks the cancer and dies out after. Obligatory, not a doctor, but I realized recently I was laboring under the delusion that fentanyl was 100% illegal when I was given some in the ICU. Lem tell you that gave me pause in the middle of a high fever. When I was getting a colonoscopy, I remember the drugs they gave me said fentanyl or had fentanyl in the name on the vial as they were administering it to me. I was like, huh, that's interesting, and then 5 seconds later completely freaked out of my mind, lol. It was a while ago, but when I was a physician in the military I prescribed Dapsone among a couple other unusual medications for a case of Hansen's disease, aka leprosy, that a Marine contracted in the Middle East. I was on the medical team caring for the patient, but I remember orthopedics being heavily involved because somehow the disease was in the bone. For those wondering, in the West, while leprosy is a disease people hear about because it's mentioned often in history, it's something you learn about once in medical school and almost never see in civilian practice. I'd also add I was not the person who made the diagnosis. I just did what I was told by my attending. I was an intern. My friend was a pharmacist. Sometimes she had to fill prescriptions for C hydrochloride, I think the label read. She said it was used in eye operations. She had an empty bottle at home to show for kicks. It had a skull and crossbones on the front. This was in the early 80s. I was told it didn't give the same recreational high as street coke because it was so pure. I may or may not have experienced diverted CHCl and hypothetically can confirm it is much different. Way more relaxing than no snow. Hypothetically, of course. CAR T cells, engineered T cells from a patient that are modified in a manufacturing center after being removed from the patient, then reinfused. The products on the market, Axicabtagene ciloleucel, goes for nearly $500,000 in the US despite all the federal funding that went into its development. The approved products are approved for pediatric ALL, a type of leukemia, and adult DLBCL, a type of lymphoma. Always interesting to click on the show charge button when I verify these. I don't remember the name of it. It's been almost 10 years. A hemophiliac suffered a traumatic amputation. We had constant blood transfusing, no massive hemorrhage, but he was steadily leaking. We gave him some sort of clotting factor replacement, an IV dose 3 or 4 times a day. Pharmacy hand delivered each dose. They ran about $5,500 each, I think. Right now I'm giving a lot of remdesivir. That'll be a cool story one day. Had a hospice patient who was getting a continuous infusion through an IV for uncontrolled pain from their terminal illness. She was getting 30 milligrams of Dilaudid an hour. For those who don't know, a typical dose is like 0.5 milligrams. The pharmacist called me to clarify and I even had 3 other nurses verify and sign off on it with me. And we had to outsource for the medication BC. This one patient was basically taking up the entire hospital's store of it. 30 milligrams would probably take out an elephant easily, and she was just sitting up in bed talking. I think someone told me later that she had some metabolic disorder also that wouldn't let her metabolize pain medicine like normal people do. There used to be a psychiatrist in my area that would prescribe insane amounts of opioids to patients claiming that they had that metabolic disorder. The most egregious script I ever saw was oxycodone 30 milligrams, 5 tabs, 6 times per day, 900 pills per month. Maybe not quite as bad as that hydromorphone dose, but pretty ridiculous nonetheless. The doctor lost his license, by the way. I worked on a GI unit as a new nurse and our last resort for really constipated people was a milk and molasses enema. I can't stand the smell of molasses now. The milk draws water into the bowel and the molasses acts as a lubricant. If I recall correctly, you have to heat up the milk to mix in the molasses and then let the mixture cool, otherwise you scald the inside of someone's rectum. When you administer one of these suckers, you do it in the bathroom next to the toilet or with a bedpan or bedside commode really close by because they are quick and effective. More often than not you end up with a major code brown afterwards. I respect you. I was a hospital pharmacy intern and I dispensed hyaluronic acid. It's quite pricey for treating osteoporosis and it's a really weird drug to administer. It has to be taken in the morning only on an empty stomach. You have to remain standing for 30 minutes after taking it. It must be taken with pure water and no other beverage. As a nurse I'd say working with Milrinone, a continuous IV med to treat heart failure. It's a last ditch effort. They have to wear a pump constantly and if it stops infusing you have just a few minutes to get it going again, otherwise their CHF symptoms hit suddenly and you better be on the phone to 911. Did not enjoy. As a vet assistant, wasn't an actual registered tech. Vodka IV for a cat that drank antifreeze. Just straight vodka. I'm a licensed vet tech. We keep high-end vodka in our Omnisil for this reason. Only ever seen it used once though. Whiskey. I had a patient with dementia who used to drink 1 glass of whiskey every night before bed. For the last 40+ years. She wouldn't settle at all without it and became a huge falls risk as she broke her hip a few weeks earlier and was struggling with her mobility. We had a doctor prescribe 25 ml of whiskey once per day and had a bottle brought to the ward for her. It was funny signing it off on her meds chart every night. We had a patient, an 82-year-old guy, whose only medication was a glass of wine in the evening. His doctor wrote an order for him to have it while he was in the hospital. If it ain't broke, don't fix it. Medical maggots. I'm a trauma nurse. Had a guy with a severely necrotic foot covered in ulcers once. Maggots eat away the dead flesh around the wound. I've used a leech on a night trauma. Someone had to stay in the room with the patient while the leech was applied to ensure it didn't fall into the nasal passage or mouth. Pharmacist here. Medical grade Ceta compound CI drops. There were 2 other people watching my every move. I did feel like Scarface a little bit picking up a 1/2-pound bag of pure sea powder. Leukemia patient here. CML to be more specific. I was on Gleevec and now on Sprisol. Every time I go to a new urgent care, my CML makes me prone to infections. Somewhere or someone new is working at my regular doctor's office. They always look at me very confused when I tell them the meds I am on. Are these meds not very common? They are stupid expensive as well. Oncology pharmacist here. The most common meds for CML but otherwise very rare. I hope your dasatinib is treating you well. Hospital pharmacist here. Had a baby with congenital hyperinsulinism. Pretty much a neonate who by a genetic defect just provides more insulin than they should, resulting in low blood sugars and all the bad side effects involved with that. We used diazoxide to treat him, which messes with the ATP channels on your pancreatic cells and inhibits the release of insulin. He ended having to go home on it long term and boluses of dextrose as needed. Medical student on a pediatrics rotation, and I didn't administer the drug myself, for obvious reasons. Patient was diagnosed with spinal muscular atrophy. Certain forms of the disease are extremely detrimental and result in early death. Unless you give Zolgensma. It's gene therapy and can give kids an honest shot at life. Price, $2.1 million. Albuterol tablets. Patient was on some clinical trial for an illness I no longer recall. Albuterol is a bronchodilator used in an inhaler formulation. Don't know of an indication for the tablets, but this fellow was taking several a day. His illness was not respiratory. Arsenic. Yup, straight up poison. I've actually administered it a few times over the years, but it definitely isn't common. It's used to treat APML, an uncommon subtype of acute leukemia. I'm an oncology nurse, so I deal with a lot of uncommon medications, at least as far as the rest of the world of medicine is concerned. 20 years ago a patient actually had a doctor's order allowing him to smoke in his room, recovering from vascular surgery. Different patient, about 5 years later was having a beer. It came with his meal and was ordered by the physician. I was curious and checked the pharmacy formulary, and sure enough, Miller Lite, Hackashaw, and Stolly vodka were available in the pharmacy. Theatre nurse here. There's a rare condition called malignant hyperthermia, which is essentially a severe and life-threatening reaction to anesthetic drugs. The antidote is Dantrolene, which is bright orange, expensive AF and kept on site at all times. I'm pretty sure there's a relatively small amount distributed across my state. However, since this condition is so rare, it often just expires. Gave anakinra, a very strong medication to short-circuit the immune system. That same patient got methotrexate, which is actually common, but in this case, I had to do a lumbar puncture and get into the patient's spinal fluid and give the methotrexate in the spinal fluid. Just ask my SO doctor. He said when working in palliative care he has prescribed the odd wine gin. If the person wants it but has no family to give it to them, nurses etc are busy, but if you prescribe it they have to administer it. A normal saline bolus, for placebo effect. It works in many of occasions where patient complains a lot but actually does not have any symptoms. So giving them this for placebo effect actually soothes their mind and helps them calm down. Antitoxin for botulism. Had to go to the airport to receive it from the CDC and rush back to administer it. Closest I've come to a TV medical drama. I was asked to repeat the story for months after. Hydrochloric acid drip in the MICU during residency. I honestly don't recall the exact clinical circumstances that led to this dude getting so alkalemic, but I do remember him getting obtunded out of nowhere only to find an arterial pH close to 7.7. Required direct call between our badass conservative attending and pharmacy before it was approved. I was asked to prescribe Dantrolene. It's basically a poison, but the most potent fat burner there is. It's used by the bodybuilding community for fat loss. It's not currently legal, even for doctors to prescribe, so I had to decline. I have prescribed HCG, human chorionic gonadotropin, for weight loss. It's a hormone secreted by women when they are pregnant, but also a good appetite suppressant. Ethanol to an infant, as a central line lock. I took care of a baby born with gastroschisis, which resulted in short gut syndrome and malabsorption. The child received TPN via a central line 12 hours a night at home. He had so many central line infections from his parents' inability to properly care for the central line that now his access sites were very limited. When he was down to the last site, I was sent into the home twice a day to teach the parents and manage the line, make sure the dressing remained occlusive, and start and stop the TPN, which included instilling a small amount of ethanol into his Broviac when not in use to prevent infection. Vodka. Gave one time because patient was withdrawing and wanted to prevent seizures and his heart rate was insanely high. Watching someone go through alcohol withdrawal is pretty harsh. I had a patient once who had dressing changes with the dressings soaked in this weird bright purple solution that stained anything it touched permanently. She had necrotizing fasciitis, flesh-eating disease, that was complicated by a reduced immune system response due to chemotherapy she was getting for cancer. I don't remember the name of the purple stuff, I only saw it used that one time in 17 years of nursing. We spilled a little bit on the floor and the doctor said that the floor would always be purple in that spot. Antibiotics enema route. The entire unit including me thought it was a mistake, so we called the hospitalist. There was no mistake. The patient was bowel incontinent. It went as you would expect. Not really a rare medicine, but a rare occurrence. I worked in the emergency room and had to deliver rabies treatment twice in one day for 2 separate, unrelated wild animal bite incidents. Not a nurse but the patient. In 2018, 13 years old, I had a case of severe pancreatitis. Worst pain I've ever felt. I remember rolling around on the floor of the sick bay. I could barely breathe. It felt like I was getting kicked in the stomach. They ended up giving me a large dose of ketamine. I felt dizzy and sleepy. According to my mum, who is an ex-registered nurse, they don't give ketamine to patients that often anymore. NVM, I realized ketamine is actually pretty common. Not a doctor, but don't we use maggots still in some surgeries to remove dead tissue? Might not be the most unusual, but it certainly is pretty dang weird. Not during surgery. As part of general wound care, they eat the dead tissue without harming living tissue. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.